The challenge and why the surgery took a little bit longer than anticipated originally is really we were treating two different issues with one procedure. Mustafa has what's called a facial cleft that you could see in his original photos that went just to the left of the midline of the face. So it was a soft tissue problem, and then also he had a bony issue. It's called hypertelorism, where the left eye socket was actually displaced laterally and inferiorly, so the distance between his eyes is much larger than what would be considered normal. So the goal of the procedure was to correct both the bony problem and the soft tissue problem. So with the distance that he had between his eyes, even with getting him, we brought the left eye socket to the right towards the midline almost 2 centimeters, which is a significant distance. And the right side, to help correct that, in addition, we moved that to the left 1 centimeter. That's pretty significant moves, but also he had a vertical issue as well, so we needed to bring that left side up so that we could get his eyes on the same level. We realized once we got him where we wanted him from a bony standpoint, just anatomically we couldn't actually do the move that we wanted to, because the left eye, you've got the optic nerve that we realized we were stretching. So we had to intraoperatively kind of compensate for some of those problems. In the end, that just took a little bit more work on our part, but we got him where we thought was a good spot for him. And then we had to start the second part of the procedure, which was to fix the soft tissue of the facial cleft. Under ideal circumstances, you could stage these and do them at different times, but because we have Mustafa out here for a short period of time, we wanted to really address as much as we could with that one surgery. So this is immediate pre-op and post-op from that initial surgery, which was about 10 or 11 hours total on our part. From there, he did great. Our post-op CT scan looked good. He was a champ afterwards. He had some problems with feeding. We did have to put a feeding tube in and help him out with that, but I'd say within less than 2 weeks, he was back at our apartment just across the street doing well. And then, unfortunately, about 3 weeks post-op, he came back to the hospital and he had a bad fever, elevated white blood cell count. His face was swollen. One of the things that was a downside of doing both procedures at the same time, both the soft tissue part and the bony work, he had a very small amount of soft tissue that was separating really his nose and his mouth from his brain. And unfortunately, that small amount of tissue broke down, and so he had a lot of mucus and just debris, and almost anything he was consuming was actually going into his intracranial cavity, and that had gotten infected.
Yeah, so he really had obviously the orbital defect, but then we got in there, we could see when we exposed from above that the lining of the brain was actually involuted down into the nasal cavity. And so we had to really work to peel that lining back and retract the brain back. And using the drain in his back actually helped that, could relax the brain and let it fall away from the nasal cavity. But as Dr. Galea said, we had a big bony defect there, and as they moved the orbits together, we tried to obliterate that skull-base defect and basically seal the skull, the base of the skull from the nasal cavity. And that tissue was pretty thin, and he did get what we call mucocele. So the nasal sinuses were kind of draining up into the base of the skull. So it was on the outside of the brain, which luckily was not a brain infection, and out on top of the lining, which we were able to easily kind of wash out and then repair that defect a little bit stronger.
Yeah, so that required a second trip to the operating room with Dr. Ghali, Dr. Notoriani, we had the whole team there. It was in an evening.
It's not ideal.
Never happened at convenient times.
And that took about 5 or 6 hours, because we went back in through the same incision on the top of the skull here. Dr. Notoriani, she took off her initial craniotomy bone flap so we could really get in there and clean everything out. And then the challenge for everybody was just trying to create something that would cut off that communication so that this wouldn't happen again. And he stayed in the hospital for another 2 weeks. He stayed on strong IV antibiotics and antifungals. And he had a CT scan before he went home, and everything looked good. And so we've kind of just been following him for the last couple of weeks since he's gone home, and he looks as happy as can be. So we're all encouraged that that second surgery was successful in kind of keeping those two areas separate so that everything can heal. Because from a bony standpoint, we were happy. It was just unfortunate that soft tissue broke down and you got that infection.
So Dr. Patel, what's been the most interesting part of the case to you?
I think the challenges that require one-stage surgery and so much coordination between all this surgical subspecialties, staff, nursing, hospitals, everything. You know, it is a challenge. You try to do this, you know, over a period of a year. I think, you know, you get this outcome, but try to get that during all in one surgery. That's the biggest challenge, and I think we came it, and I think we did good. The outcome's really good. So.
Okay. Yeah, I think that's a very important point for y'all to pick up in your coverage, is that normally this would not have happened in such a consolidated time frame.
Right.
But they were bold, I would say, in their approach to say, hey, we've only got him here for a limited amount of time, and we want to make the maximum amount of improvement that we can. So kudos to the staff, because I can't imagine what pressure that was to try to do this in such a short time frame and successfully.
Yeah.
So if you would tell Mustafa to take off his sunglasses, so we can see the movement improvement, handsome, more handsome than ever. As you can see, he is very happy with the outcome.
And kind of put this out there to all y'all, what would have been some complications that could have came if Mustafa couldn't have gotten the surgery or couldn't have gotten the care that he did? What could have led, you know, down the road?
Well, I mean, based on the little bit of bony defect and the way that the brain was herniated, certainly over time that there's a potential that defect could have gotten worse, and he could have had more of a what we call encephalocele in that area. And I'm sure, you know, even just from social integration and things like that. It's easy when kids are little because they don't really understand that, but you know, sometimes people are really mean anywhere you are, and that can be really hard on children and adults. So,
not just medically, but
right.
How would it have gotten in the way of his daily life, other than, you know, social?
I know he
nasal cavity. But
he was wearing Band-Aids and trying to cover his facial cleft that's just completely exposed. So just kind of continually put him at the risk for infections and things like that, and especially in like a dustier environment. I know that was probably tough for him, just trying to live a normal life with that big defect right in the middle of his face like that. Yeah, the original surgery was April 24th or somewhere around there, so we're a little less than 2 months from that, and then we're probably almost a month out from the revision.
And any other anticipated surgeries?
So he was seeing Dr. Richards, who's a pediatric ophthalmologist, because we thought there was a chance with that amount of movement that you do with one orbit. Oftentimes they require surgery just to kind of strengthen the extraocular muscles. But Dr. Richards saw him on Monday and said he wouldn't need surgery, and then he's going to get Mustafa some prescription glasses before he goes back. And so no more procedures at this point. The biggest thing for him is just time to continue to recover. A lot of this, he's going to continue to improve over the next few months. Some of this swelling improves. In a perfect world, we can go back in and do touch-up work to the lip and the nose, but I think considering the time frame that we had and to accomplish this all really in one shot, we're ecstatic with where he's at.